let's talk about the top 3 spine health myths and facts. You've probably heard that bed rest is the best thing you can do for back pain. But is that really true? Today, we're busting the biggest myths about your spine and revealing what the science actually says. So hi, I'm Dr. Deeptee Jain and I'm a spine surgeon, and I dedicate myself to helping people with back pain. If you're tired or you're tired of confusing advice or scared to move because of what you've heard, this video is for you. So let's set the record straight. Myth number 1, bed rest is the best treatment for back pain. This is not true. Total rest might feel like a good thing in the short term, but we actually know that prolonged inactivity can actually make back pain worse. We have good evidence from the North American Spine Society as well as the American Academy of Family Practice Doctors, whose guidelines say that the best thing we can do for our back pain is to get up and move as quickly as possible. Movement, when guided and safe, improves circulation, reduces stiffness, and speeds up recovery. In most cases, staying mobile is the better medicine. Myth number 2, degenerative disc disease means that you're doomed. Again, this is not true. Degenerative disc disease might sound scary, but it's actually a normal part of aging. Everyone gets degenerative disease as they get older. It's just like getting wrinkles or getting gray hair. And oftentimes it doesn't even cause pain. Many people with changes in their disc and disc degeneration live pain-free, active lives. If I take an MRI of 100 people who are 80, for example, over half of them will have degenerative changes in their spine, probably actually more than that. So don't let the name scare you, and don't let it determine your future. Myth number 3, surgery is the only option for herniated discs. Again, not true. And in fact, I have another video that addresses this topic in much more detail. So most herniated discs get better with time and conservative care. Surgery is reserved for very specific cases in which pain does not improve after having non-operative treatment modalities. Also, we can consider surgery in cases where patients might have severe nerve compression and might have some neurologic problems, namely weakness, in one of the nerve distributions. But for most patients, physical therapy, different kinds of medications, injections, bracings, these things are adjustments enough to actually get the nerve pain to calm down and for patients to actually heal and thrive in the future. So a quick recap. Bed rest is not the best cure for back pain. Everyone gets degenerative disc disease as they get older, and movement is medicine, even for herniated discs. A scary diagnosis doesn't mean your story is over. So if you learned something new or we busted a myth that you believe, give this video a like and let me know in the comments. What's the most confusing thing you've heard about back pain? So let's clear it up together.